say emergency?
No.
So wacha nikutumie gari.
Airport 253 from dispatch. Confirm copy.
Analyst copy.
Responding to an emergency can be the most challenging task, even for the most professional of emergency response services in the country. This can be riskier for the patient if the emergency responders are not professionally trained on how to handle patients. One slight miscalculation from a paramedic can cause irreparable damage, or worse, death. This is why, over the last 9 years, Emergency Plus Medical Services, a commercial company under the Red Cross, popularly known as E+, has undergone significant expansion, increasing its fleet based from 5 state-of-the-art ambulances in the standards of basic life support and advanced life support to 128 ambulances spread across the country, becoming the largest private emergency service provider in East and Central Africa.
The 5 ambulances initially are operating within the urban areas, Nairobi, Kisumu, Mombasa, and we realized that there is need even beyond the urban areas.
Every major town of this country, we have an ambulance. In Nairobi, on a normal day like today, we have ambulances along major highways.
E+ was founded on 23rd March 2010 in Kenya. Its main mandate was to provide ambulance and pre-hospital care services. The concept of E+ was born from a tragedy of 2006 when a senior staff of Kenya Red Cross Society was involved in an accident in the upper eastern region of Isiolo County. The only option was to use their own ambulance, which was an urban vehicle and not equipped to drive to Isiolo County. This one event triggered the idea of basic and advanced life support ambulance, setting the precedence for Kenyans to access pre-hospital medical care and ambulance services 24 hours across the country.
The Embu hospital will be better.
Contact our dispatch center at 1199. The nearest ambulance will be dispatched to your location. And when I say that, I mean proper ambulance to professional standards, fully equipped with state-of-the-art equipment, life-saving, ambulance that can give care on transit and not just transport vehicles with stretchers, paramedics and EMTs, including the operator who drives the ambulance is equally a medic.
I am able to use all the equipment that we have in the ambulance, so I'm capable of helping in patient care.
Then we have our paramedics, who are critical care nurses with quite a bit of experience handling almost all emergencies.
Nikiamka asubuhi na kuja kazini, najua niko na life za kusave, niko na kazi ya kufanya, kwa sababu kuna watu hapa nje wananitegemea.
In addition, I think this is one of the few, if not the only, ambulance service that actually has a full-time medical director.
I even had to go to theatre.
My role basically is to supervise and also provide support to the medical team on ground whenever they need to consult me on any medical matters. I'm always on call. It's a 24-hour, 7-day-a-week job.
This is a cordon radio. It covers a range of about 1,000 kilometers radius, so I can actually use it all over Kenya.
This is our dispatch center. This is where we coordinate all activities in regards to emergency calls. We have 4 dispatchers during the day and 2 dispatchers at night because this is a 24-hour service. This is where we are able to monitor the ambulances. It's also able to monitor the dashboard of the ambulance. Now, our ambulances are unique in the sense that we usually call them a moving ICU. They are well equipped to handle the condition of the patient at the time.
Kuna wakati unapata unafika kwa facility ama unafika kwa hospital, unapata ile facility unaenda haina equipment kama ile kwa gari yako. Yani my car is more like an hospital than that hospital you have gone.
And that's why as an organization we've been involved with the Ministry of Health in trying to develop an emergency medical policy that creates standards for all ambulances and what is expected in any vehicle that is called an ambulance.
Our ultimate goal was to achieve ISO certification. ISO certification is an international quality standard.
Quality management system basically is just having the right system that is very consistent and meets customer satisfaction and their needs as well.
ISO certified, that is a multi-class and quality is now there.
Certification of E+ with ISO 9001-2015 is a clear indication of its journey of continuous improvement in living up to the quality of professional service on emergency medical services.
It's just the commitment we are making to our clients and giving them the confidence to feel that they're in safe hands, because people associate with quality, and quality is defined by what you have invested in terms of system, in terms of time, and in terms of resources.
We are declaring it publicly that we are going to go beyond the standards in terms of quality where we have been. And I want to commend you for that courage, as I encourage you that the journey has just begun. It is keeping that high standard that we are going to be watching and expecting nothing less of that. But we will give you the support that we need to from where we are.
For us, we say we will never leave anyone behind. We will assist and treat everybody, even if it is for free for that matter.
I feel there's a sense of fulfillment. Yeah, you get a sense of purpose. Yeah.
I think it's the greatest gift, even when you go to sleep and you remember that casualty or that patient who you are there for in time of need.
But looking at where we've come from, with no services, to today, where we say 24/7, 365, a Kenyan will always have an ambulance, is the pride that we live in. What we have achieved is good so far, but it's just begun now. The real work is there, and that's what we want to do.